Good morning, everyone. Thank you all so much for joining us for this important press conference as we are here to talk about the efforts by the City of McAllen I.S.D. and Hidalgo County, especially Precinct 2 Commissioner Eddie Cantu, in hosting this closed pod vaccination clinic for elderly clients from adult daycare centers throughout Hidalgo County in Precinct 2. My name is Xochitl Mora. I'm the Director of Communications for the City of McAllen. So proud to welcome you all here as we continue our efforts to vaccinate our community. Before we continue, I would like to recognize our special guests here with us this morning, including the Honorable Jim Darling, Mayor of the City of McAllen. Also joining us is the Honorable Omar Quintanilla, Commissioner District 3 for the City of McAllen. From McAllen I.S.D., we have Superintendent Dr. Jay Gonzalez. And from Hidalgo County, we have the Honorable Richard Cortez, Hidalgo County Judge. The Honorable Eduardo Eddie Cantu, Commissioner Precinct 2. And from Health and Human Services, the Chief Administrative Officer, Mr. Eddie Olivares. Also with us from the City of McAllen is the Assistant City Manager and Emergency Operations Manager for the city, Mr. Jeff Johnston. To talk about today's effort and why it's so important to host this clinic today, I'd like to bring up the Honorable Jim Darling, Mayor of the City of McAllen.
Thank you. Oh, I thought you were going to spray me down. That's not a bad idea. Thank you, and good morning, everybody. And first, I want to thank the school district and the county. You know, this is a partnership, and we hope that everybody understands that we're all in this together, but we're all in this together in a lot of different ways. And you know, it's been confusing. There's a lot of different locations, a lot of announcements out the vaccination, and really what it is for our partnership with the school district is they have a lot of nurses. And the nurses have some time available because of the limited number of kids going to school, and so the school district has been very generous in partnering with us and making sure that we have the health care people that can administer the vaccination. The county is very helpful because they're the ones that get the vaccination and coordinate that, and that's a tremendous job when you think about it, what they're doing throughout the county, and relatively complicated and relatively don't know how many we're going to get each week until they get the announcement, etc. And so we really appreciate that partnership. We think that's the best way is to partner up with the county so it's a more coordinated effort in making sure all our citizens get vaccinated. We're also working with the Council of Governments in the M.I.S.D program to make sure that we get those shut-ins that are in our community vaccinated. And that's kind of been a logistical situation for us, but I think with the partnership of the county and the school district and Amigos and the Council of Governments, which I am fortunate to be president of this year, we're going to tackle that problem and get the people that are shut in vaccinated. And we're trying to work through that process now. One of the complications with that, obviously, is everybody has to wait 15 minutes to see if there's a reaction. And so it's getting shots in people's arms that are shut-ins relatively easy. It's the 15-minute and having somebody trained to administer the drugs that are needed in case there's a reaction to them has been very difficult. But we'll get to that too. And so the coordination is very, very important. And then on top of that, I don't know if you've been following the news lately, but I think you guys probably have. We've had a change in the border protection situation with allowing some asylum seekers to come across. So we're anticipating that, and that was, if you were with us in 2014 and 2018-19, that was a huge problem, and it's still a huge problem, but now we've added COVID to it as an additional challenge. So it's challenging times here, and I think the best thing I could say to everybody is be patient. We're going to try to get everybody vaccinated. Wear your mask. I saw today people were talking about double mask. Commissioner Quintanilla's got a double mask on. And you know, let's make sure that just because you get vaccinated doesn't mean that you can walk around without your mask or you're like super person. Okay, you still have to take precautions. You could still, I'm going to get Eddie, you can correct me later, but all that means is your body is ready to fight off the infection. Doesn't mean it doesn't attach to you and that you can't attach it to other people. So, you know, just because you're vaccinated, you're not Superman. You wear your mask just like you weren't vaccinated. That's the best way I can describe it. Once you get vaccinated, still conduct yourself as if you weren't. And we'll all get through this together. So I want to thank our partners. It's a great partnership, and I've gotten to know these guys a little better. We talk about it every day, and for sure. And so it's great to be in the Valley still. It's a great place to live. It's a great place where we cooperate as governments. And so let's be careful out there. Thank you.
Thank you, Mayor, and for your leadership to ensure that everyone in the city of McAllen and Hidalgo County is safe and vaccinated. To talk about the efforts to vaccinate everyone through the clinics here at the Convention Center with the nurses from McAllen I.S.D, I'd like to bring up the Superintendent, Dr. J. Gonzalez.
Good morning, everyone, and thank you all for being here at this very special event. It's a pleasure for us to be a part of a wonderful team. When you look at the County of Hidalgo and the City of McAllen and McAllen I.S.D working in unison, it makes it possible to have events like this that are so important to our community. I'm very proud of our team, and I'm very proud of the fact that we're part of a bigger team. When you look at today's situation, we have 20 RNs that are giving vaccinations. We also have principals and directors and executive directors that are a part of a bigger team. And we're very happy to be a part of that bigger team that includes the county as a big player in this and includes the city of McAllen. And when you have that kind of synergy, then you can put on vaccination clinics like this. And we're getting a lot of compliments from everybody that's coming through with regard to the systems and processes and how smooth they are. And that would not be possible without the partnership that we have with Hidalgo County and the city of McAllen. So McAllen I.S.D is grateful to be a part of this team, and we will continue working hard to make this happen for our community. Thank you.
Thank you, Dr. Gonzalez, for your leadership with the school district and for your partnership with the city of McAllen on a daily basis. Throughout this pandemic, we've been led by the leaders of Hidalgo County. And to talk about those efforts and that vision and the mission for Hidalgo County, I'd like to bring up the Honorable Richard Cortez, Judge for Hidalgo County.
Thank you, and good morning, everyone. First of all, I want to start by thanking the city of McAllen for hosting us here today. You know, it's always great to be in this city because you really get this southern flavor of hospitality, and you always feel very welcome here. Hidalgo County is around the 7th or 8th largest county in the state of Texas. We have 254 counties. Our population, we believe, is going to be at least 1 million people or more. If you look at the statistics of what makes up the population, it's estimated that we have 110,000 citizens over 65. So when you consider that we're the 7th largest county in the state of Texas, and you have approximately 110,000 people over 65, and you are tasked with vaccinating the people in an efficient way, in an equitable way, that is a huge, huge undertaking. That could never get to a point of efficiency without the collaboration, the effort of all of our communities and school districts working together. Yesterday, I attended a few of the events that we were having throughout the county. I almost cried because I was able to see this partnership of schools, cities, volunteers working together for the sole purpose of helping people and getting them safe and healthy in this very serious pandemic. That is the power of communities working together. Today, we're seeing the same efforts. We've already heard the importance of teaming together and sharing the resources with one another with one goal in mind. That's to help everyone in our community. When you consider the fact that we also have maybe 5 international bridges here in Hidalgo County, and we rely on people crossing goods and services from Mexico over here. Imagine if our federal people get contaminated with this disease and they have to close the bridge. So do they become important for us to vaccinate? Yes. Can you imagine all the families that both husband and wife have to work, and they have to now keep their kids there? But they have a mortgage, they have a house payment, they have all these things that they need to do. They're caught between the necessity to work, the necessity to care for the children. So what I'm seeing here today is all of us should be very proud that we live in Hidalgo County and we have the type of people we have. because we have come up to the task of serving others, caring about what others think, and working together. So today is an example. I'm going to tell you that when you put the math together and you add what the county, the other hospital, the university, medical school, I mean, we've done about 100,000 vaccinations. Well, that's 10%. So I think we've done fairly well. And I thank all of you for being here and caring and sending out the message. As Mayor Darling has said, be patient with us. We have more need than vaccines. We're trying to be efficient. Every day, every week that we do this job, we get better and better and better. And I want to thank our staff and the Hidalgo County Health Department, Eddie Olivares and his staff, and everybody for doing a great job. Thank you very much.
Thank you, Judge, for your leadership and compassion throughout this pandemic. To talk about why today's COVID vaccine clinic, this closed pod clinic, was so important to host, I'd like to bring up a very dear friend of mine, my fellow St. Mary's alum, the Honorable Eduardo Eri Cantu, Commissioner for Precinct 2 for Hidalgo County.
Xochitl and I went to college together at St. Mary's. Thank you, Xochitl. What's important in partnerships is to recognize your partner and to thank them. So I'm going to take a little time to thank everybody that was involved in today's event. You know, starting with the City of McAllen, you know, the Mayor, Jeff Johnston, Jolie Perez, Yahaira Flores, McAllen Metro, Mario Delgado, helping in the transportation of people. Of course, City Manager Roy Rodriguez and the City Commission. Thank you, Omar Quintanilla, for being here with us. We also have a great partner in McAllen I.S.D. Without their nurses, we wouldn't have anybody to put these vaccines into our elderly. Thank you, Dr. Gonzalez. Thank you, School Board. Thank you for everything that you've done. Of course, police and fire from the City of McAllen, we couldn't do it without you. We're very thankful. My colleagues on the Commissioner's Court, my colleague, Judge Richard Cortez, and all the others who have had the wisdom and the ability to do something that's, you know, monumental, right? And the fact that we have a very bad supply and demand issue, right? And so we're doing the best we can with what's been given to us. I want to do a quick history before I talk about today. Under the leadership of the county and Eddie Olivares, we've set up a bunch of pods, a bunch of different places within the county. It started in Mercedes, it went to PSJ, it went to La Jolla, Weslaco, Hidalgo. So many different cities and communities have set up pods. Why is that important? Experience. So that when we do finally get enough supply for the demand that we have, we're able to put everybody to work and put the vaccine in arms. That's important. So when we get criticized, well, why that city, why that school district? It was a master plan. We had to get everybody the experience and the organization so that when we finally get the supply that we need, we're able to put the vaccines in arms. So once we did that, we decided, you know what? We need to help the elderly. And what's the best way of helping the elderly? Well, we know that our elderly go to adult daycares. And in adult daycares, well, they're amongst their friends and the other people at the adult daycares. So we figured since they're in a closed environment, we really had to consider them. And so that's what we did. Today, in the City of McAllen, we're vaccinating all the adult daycares in McAllen, all the adult daycares in San Juan, and all the adult daycares in Hidalgo. And I'm very appreciative for the City of McAllen. They didn't use city lines, boundaries, and say, hey, no, not them. They were like, absolutely, we'll help you. Next week in FAR, we're going to do the same thing. FAR has as many adult daycare constituents as these 3 other cities. So we're going to dedicate a pod to the city of FAR. We're going to vaccinate our people in the adult daycares. As statistics have shown, it's not my opinion, it's statistics. The people that die at the highest rate are the elderly. 60-year-olds, 70-year-olds. Look at the stats every day. 80% of the people that you see are 60 and 70-year-olds. Sure, you have others, and they're important to us too. but we have to have the compassion and dedication to think of the elderly first. They're also the people in the hospitals. So the more elderly we have in the hospital, the more it affects everybody else. And so the sooner that we can take care of the elderly, it benefits the whole community. You know, at the current rate of pharmaceutical companies, it's going to take, any estimate is 300 days, right? Biden was saying a million vaccines a day. Well, we're 300 million people. So do the math, that's 300 days. Even if we're stepping it up to 1.5 million vaccines a day, that's still 150 days. So I beg the community to have the patience with us to get it to the people that need it most. And we'll get to you. But there's no way at this point that we can deal with the demand that we have. So I ask and I beg for patience. I'm obviously not 65 and older, and I will not get the vaccine until we tend to our most vulnerable first. God is great. We have a vaccine. Now let's take it one day at a time until we defeat this horrible pandemic. God bless us all. Thank you.
Thank you, Eddie, for your leadership in ensuring that the most vulnerable in our community are vaccinated today. To talk about the efforts for Hidalgo County in making sure that vaccine gets everywhere it needs to here throughout the county, I'd like to bring up the Chief Administrative Officer for Hidalgo County Health and Human Services, Mr. Eddie Olivares.
Hello, everyone. Eddie Olivares, Chief Administrative Officer for Hidalgo County Health and Human Services. Well, today, what can I say? The leadership has spoken. They've made it clear that this is a partnership between all our community efforts, city, school, county, vocational schools, STC, UTRGV. All of us are partnered together. Thousands of people are working together hand in hand to work this out. Commissioner Cantu, Judge Cortez, Dr. Gonzalez put it very eloquently. There's a strategic national stockpile plan. Many of our teams have worked on this for many, many years. Some of our school districts, PSJ School District, La Jolla School District, Edinburgh School District, have been part of that strategic national stockpile plan through Operation Lone Star. Many of you have been involved with Operation Lone Star. That is the foundation and the model that's being used to establish these pods or points of dispensing. What's real clear here is also the incident command structure model. Each of the cities and school districts report and discuss these issues directly with the emergency manager for each city. The school district emergency manager talks to the city emergency manager. The city emergency managers talk to our emergency manager, or Chief Saldaña, and of course the emergency management director for the county is Judge Cortez. The emergency management director for a city is the mayor. So Mayor Darling is the emergency management director for the city of McAllen. Those discussions and those points follow a very clear line of order and process, which mimic and go along with the national level of operations. So that incident command structure is critical and vital for our operations throughout South Texas. Today, the focus is on elderly. Want to stress something. Currently, the governor of Texas has stated that if you have more than 15% of the hospital admissions are COVID, that impacts us locally on an economic level. 50% of operations, elective surgeries, all those things would be affected by the level of admissions into the hospital. Over 2,800 people have died in Hidalgo County. 80% or more of those are over the age of 50. So the focus is on the elderly because we are able to clearly work with that and help our hospitals and our medical community to try to get back to some type of normalcy in the healthcare industry, which in turn will support the economic components of our community. But all of this is being done because of the sacrifice the love, the passion, and the care of hundreds and hundreds and hundreds of people. We have school nurses from McAllen School District, PSJA School District, La Jolla School District, Edinburgh School District, Westlaco, Donna, all of them. We have every single school systems involved directly with us. STC, the vocational schools, volunteers, paramedics from McAllen Fire Department, Mission Fire Department, Alton Fire Department, Westlaco EMS. All those are involved in vaccinating and helping. I want you to leave here with one thought, and I've said this before and you've heard me say it before. This is something that your grandparents would talk about when they would talk about the Great Depression, when they would talk about World War II, and you'd hear all these stories. When I was growing up, we'd sit outside. We didn't have air conditioning back then. We'd sit outside and a nice summer breeze, and we would tell each other stories of times past. Well, 20 years from now, each of you reporters here will be talking to your grandchildren, and we'll be talking to your children, and they're going to ask you, Dad, Mom, what did you do during the great pandemic of 2020? Well, you're going to be able to say, you know what? I took part in a coalition, in a collaboration of community leaders, of volunteers that saved lives and made a difference. So we have an opportunity here to step up and help save lives and be part of the solution. So I thank every single school district, every single agency that's helping us. That's the goal today. We're looking at 1,000 vaccines today. Hidalgo County as a whole, this week was allocated over 16,000 vaccines. That's not very much. But we're trying to be as efficient and as thorough with them. Hidalgo County Health got 6,000 doses, UTRGV 1,975, DHR 6,825, and then there was miscellaneous other facilities that got some 200 or 300 additional doses. We hope that those numbers increase. We have the capacity today, Dr. Gonzalez and I, with his wonderful team, we have the capacity today that we could do 2,000 vaccinations in 8 hours. We have that capacity today. We don't have the vaccine. But they're ready for it. They're ready for it. All the other school districts, all our other partners are ready for those large-scale vaccination clinics. There's even plans for a 10,000-person drive-through. There's plans for that in place already, and the mechanism is there. We just need the vaccine.